Hi everybody, Dr. Yao here. Today I'd like to go over some of the orthodontic records that I take in my practice, specifically the x-rays, otherwise known as radiographs. Now, why do orthodontics take radiographs and what information can it possibly give? Let me kind of give you some insight. There are two radiographs that I like to take in my office. The first one is the panoramic radiograph, and then the second one is the supplementary radiograph. Let's start with the panoramic radiograph. Here is an example of a panoramic radiograph. It is literally a panorama of your teeth. I can see your upper jaw, I can see your lower jaw, I can see all the teeth inside. I can even check out the joints, which are where the clicking and popping sometimes happen if you chew gum or you open too wide, as well as the nasal cavity and your sinuses. So I can see pretty much everything here. This gives me a lot of information before I even look in your mouth. I could pretty much tell you how many teeth you have, where they're located, and how they're positioned with all the other teeth with this one x-ray. It also gives me information of what's happening underneath the bones. For example, in this particular patient, she has all the teeth that she's supposed to have already fully grown, but she does have 4 teeth kind of in the back where they're still underdeveloped and still underneath the gums. And those are her wisdom teeth, otherwise known as third molars. This x-ray is very within normal limits. There's nothing remarkable on it, as in there's nothing that stands out that is something of concern. Let me show you an x-ray where I did find something of concern. Hopefully you can see it too. There are 2 teeth in this patient that are going in the wrong direction. Instead of coming downwards and into the mouth, they're going inwards or towards the center and to other adult teeth. This can be a big issue. These 2 teeth are known as the canines, and here they are known as impacted canines because they are blocked out and impacted and unable to erupt. With this particular x-ray, I can really see the positions of these teeth. I can see which direction they're going, and it helps me determine, well, how do I bring these in? What direction of force can I administer to allow them to come into the mouth? And I use this x-ray with an oral surgeon, and we work in conjunction to make sure the treatment plan for this patient really is solid and that those teeth eventually come out and she gets a great smile. So this is the panoramic radiograph. Let's go into the supplementary radiograph. Here's the supplementary radiograph. It is a picture of the side of your face. And you might go, well, why would you need a side of my face? Let me tell you, this gives a lot of information of the front, back, or anterior, posterior direction. So it tells me where the teeth are, where the jaws are, all relative to your cranium or your skull. I can also see your skeleton, which can give me information on, your age in terms of your skeletal maturity. But most importantly, it gives me the front-back relationship, which is kind of fun. So I'm able to take this x-ray and then I can trace it and do these like color tracings on it and give me all these numbers and these measurements and these angles to determine where does the discrepancy truly lie. Let me give you an example of that. So here's a patient. He comes in and his chief concern is that his top teeth stick out. So my thing is, well, is it really the teeth that stick out? Or is it just your top teeth sticking out but your bottom teeth are really leaning back? Or is it your jaws? Is your top jaw more forward or is your bottom jaw more back? Or is it a combination of all these things, whether it be the jaws or your teeth? So this x-ray allows me to do certain measurements and I compare those with average. And then I'm able to determine where the discrepancy truly lies, then cater that treatment to target those areas of discrepancy. Let me give you another example. So this example really shows in more of an extreme, it's called mandibular prognathism. And you can see, and hopefully you can see this, but you can see that the lower jaw is pretty forward in this particular patient. And for him, he definitely has a jaw issue. The lower jaw is definitely more forward. Now the question is it only the lower jaw forward, or is there an upper jaw issue, as in the upper jaw is a little bit back? So by looking at this x-ray and then doing some of the measurements, I am able to determine where the discrepancy is and really make sure that whatever treatment I render or propose to the patient, that it really targets the issue at hand. So that's a brief overview of the two x-rays that I take, the panoramic and the supplementary. If you have any questions on these x-rays, please let me know. You can comment below or send us an email. As always, it's nice to see everybody. There are other x-rays that orthodontists do take. These are only the two very basic ones. We may cover the other ones in a separate video, so just go check those out when they come out. Thank you, everybody, and thanks for watching.